Secretary, I agree with a lot of my colleagues' statement. I actually had hoped, I didn't support you. I thought taking on chronic illnesses was going to be important. I've got 2 kids, as we discussed when you met, that have chronic illnesses. I'm not sure that the focus on red dye and seed oils are going to fully solve that problem.
Of course they won't.
I would say this, that seems where your emphasis is. I want to go back to just, again, some basic facts. Do you accept the fact that 1 million Americans died from COVID?
I don't know how many died.
You're the Secretary of Health and Human Services. You don't have any idea how many Americans died from COVID?
I don't think anybody knows that because there was so much data chaos coming out of the CDC, and there was so many perverse incentives, and these are model studies.
You don't know the answer of how many Americans died from COVID. This is the Secretary of Health and Human Services. Do you think the vaccine did anything to prevent additional deaths?
Again, I would like to see the data and talk about the data.
You have had this job for 8 months, and you don't know the data about whether the vaccine saved lives?
And that's the problem, is that they didn't have the data. The data by the Biden administration absolutely dismal.
Who is politicizing? You're saying the Biden administration politicized all the data? Go back to what Senator Cantwell just said.
Fired Dr.
Go to the Trump Surgeon General.
They fired Dr. Krauss. They fired all the people who questioned the orthodoxy. They fired Dr. Gruber, Dr. Krauss.
So, Mr. Chairman, the Secretary of Health and Human Services doesn't know how many Americans died from COVID. Doesn't know if the vaccine helped prevent any deaths. And you are sitting as Secretary of Health and Human Services? How can you be that ignorant? Like, you know, I remember when we went through the hearing with you, I asked you about community health centers. You didn't know what role they play. I've been visiting community. I'm glad you got to one, I think in April. I tell you what I hear on community health centers, they are terrified, with all due respect to my good friend, the chairman, of the big awful bill, because they are going to lose health care across the board. They already live in food deserts. They can't get to a nutritionist because Medicaid doesn't do enough reimbursement. If you're going to want Americans to get healthier, should they have access to nutritionists? Should they have access to good science about healthy food?
Absolutely.
Well, then how is that going to happen with the Medicaid cuts that are taking place?
There are no cuts to Medicaid.
Sir, that is an absurd. There is not a single, some of my Republican colleagues, but there is not a single study that does not, and I can tell you, I was in Franklin, Virginia a couple days ago. The rural hospital is going to close. The hospital system was so afraid they wouldn't even let me have the meeting there. But that rural hospital is going to close. And they are looking for where those folks are going to go. I mean, you're supposed to be doing health care policy, not being the doctor in residence for all of America. I hope I can just say, I'm still going to trust my doctor rather than your health advice.
That's the problem with our thing.
And obviously, Tom Cotton's going to, who knows who he's going to trust.